When you talk about kind of the federal government coming forward, what type of policy exactly would you like to see from them?
Absolutely. So I'm actually in St. John's this week with pro-Medicare advocates from across the country, and we're calling on the premiers here to take a stand with us in asking the federal government to take leadership. And when we're talking about federal leadership, we're talking about a couple things. Right now, the current government has let our health accord expire, and that is an agreement that guarantees the funding and the national standards that we need for healthcare. So we need a new agreement to make sure that we have the funds that we need to provide healthcare across the country. But additionally, what we need is it's a time also to move forward with our healthcare. We're the only country in the world that has public healthcare that doesn't include a national drug plan. So at this point, you can get the medications that you need while you're in the hospital, but once you leave, it becomes your financial responsibility personally. That's not a very effective system. So we think it's time to move forward, talk about a national drug plan. We also want to see the federal government talking about a national plan for seniors care. I mean, we can see across this country there just isn't enough care for our seniors. And it's our federal government's responsibility to make sure that everyone has the resources that they need to age comfortably and age with respect.
In order to do these things, do you think it's a matter of money, or do you think we just need to restructure the way our health systems work?
That's an excellent question. I think it's both. We need money. When we had the health accord, we were guaranteed a 6% increase in funds annually. That's gone down to 3% now. And with the current situation with the federal government, funding into the healthcare system is actually tied to the GDP. So if the national economy goes down, it means we'll actually have less funds to provide healthcare to Canadians. That's not the kind of system that Canadians are used to. It doesn't represent Canadian values, leaves a lot of vulnerable people at the hand of the market. And that's certainly not something that we're comfortable with. So we need the reinstatement of stable funding so that plans can be provided. But in addition, we need that leadership and we need that innovation. We need to look at different ways of organizing things. We need more workers. We need more healthcare professionals. We need more nurses. We need more doctors. We need more long-term care beds. So some of it is about the strategy, about the leadership, about the innovation, and then a certain amount of it is just making sure that the stable funds are provided so that we can adequately administer this system.
Right, that is Melissa Newitt. She's the Interim Executive Director of the Canadian Health Coalition. Melissa, thanks for being with us.
My pleasure. Thank you, Sonia.